Want to move to the opioid crisis. Here's Health and Human Services Secretary Alex Azar. Roll tape.
Overdose, both from the basic opioids, from heroin, and especially from the risk of fentanyl, is just so tremendous. People are dying at such a great pace. Now, we're making progress here. We are seeing the prescribing of those legal opioids that are the beginning of addiction for so many people. That is going down.
Okay, now that's the important part here. The prescription of opioid drugs is going down. Dr. Marc Siegel conducted that interview, and he joins us now. All right, Dr. Siegel, just moments ago on this program, the governor of Kentucky was on our air. He said 79 opioid pills had been prescribed for every man, woman, and child in Kentucky in 1 year. Roll tape, please.
And in Kentucky, last year, we did have a tremendous amount of these pills dispensed. 359 million of these pills for 4.5 million people. So 79 pills for every man, woman, and child.
That's incredible, Doctor. What are doctors doing prescribing like this?
So Alex Azar agrees with me on this, HHS Secretary, and agrees with you that doctors are at the heart of the problem. Okay. That no matter how much pressure doctors got from the need to treat pain, which, by the way, a new study shows opioids don't even work the way that doctors thought. But despite whatever pressure you get, it's your pen writing that prescription. Doctors are to blame. They're one of the biggest problems here, and it's an absolute disgrace. Now, Azar did say to me that he thinks that they're starting to make progress. He's meeting with all the governors, and he thinks the rate of prescribing is going down. He said that in the soundbite. Okay. That's not what CDC said from a year ago. So, in other words, this is progress. And Azar believes that President Trump taking the lead on this and showing courage and fighting it head on is going to help.
No, okay.
Doctors have to be targeted.
Oh, I agree entirely. I mean, I can see the doctors are at the heart of the problem here. But what about the fentanyl problem? That's really the deadly drug that they mix on the street for street drugs. What can you do about that?
Well, he talked about that, too. We have to prevent the illicit fentanyl from coming in, because that's the most powerful kind that's made out of the country by chemists, 50 times more powerful than heroin. When you take it, you don't know what you're getting, you stop breathing, and you end up in the hospital. That's a large part of the overdoses. That has to be cut down. But also...
But that's got nothing to do with doctors.
Well, so
doctors are not prescribing fentanyl.
Well, yes, they are. Now, here in the United States, doctors are prescribing legal fentanyl, so that gets it out there. It was supposed to be used for palliative care for dying cancer patients. Instead, it's being used across the board. It's overused. Fentanyl is one of the overprescribed drugs. That's what got it in the mind of illegal chemists. I'm not kidding. This is part of the problem. This overuse of prescription drugs. Now, this past week, a study came out that showed that it ends up in the medicine cabinets, the prescribed drugs, the prescribed opioids, and people take it that it wasn't even intended for. And when they run out of it, guess what they do? They buy illegal heroin and fentanyl. Okay. And those are the people that are dying.
So to cut to the heart of the matter,
kids are dying.
They are indeed. Cut right to the chase here. It is a doctor's problem. Overprescription by doctors are at the very heart of this problem. Yes?
Yes, but I want to add that HHS can put pressure using CDC, which is part of HHS, using the Drug Enforcement Agency. Everyone can put pressure on doctors. The state governors can restrict doctors prescribing. Here in New York State, we have an I-STOP system. If I want to prescribe an opioid, I have to register it online. That should be in every state, and we're moving in that direction.
Yes,
got to cut down on doctors prescribing.
Great interview, Doctor.
Thank you.
Real good stuff. Hard-hitting. Thank you, Dr. Siegel.